Hi everybody, David Junga, Pulmonary Rehab Associates in Stratford, Connecticut. I just wanted to talk to you today about a big question that we get asked all the time. Do I need a spacer for your inhaler? Or even, what the heck is a spacer? Some people don't know. This is a spacer. They call it an opti chamber or an aero chamber sometimes. This is a spacer. This is used in conjunction with your inhalers that are shaped like this. I'm going to tell you a little bit about when and why to use it, and then I'm going to demonstrate on how to use it. One of the reasons why you would use an aero chamber or a spacer like this is for whatever reason, if you take your inhaler, and we did a previous video on our blog about using your inhaler properly. So if you're going to shake it, depending on the timing, depending on if you can have the strength to squeeze it okay, and to be able to squeeze it and then slowly breathe in, there takes a lot of coordination sometimes with that. And sometimes if people's hands are a little shaky because this medication, some of them can make you really jittery. You may not have the strength or the coordination or anything. This alleviates a lot of the timing that you have to work on to try to get this. So you could take it, and normally if you just go to spray this in your mouth, you'll see the mist, and that's it. Now you have to time when you're squeezing to breathe in and bring all those particles into your lungs. This can help alleviate that and stop that problem with the timing. You take this, you can put it in the end right here, and it's just a rubber seal and it fits nice and tight in there. And then what will happen is you can take this and squeeze it, and you'll watch the chamber fill up with the medication. Now the medication is in here. All you have to do is take this off, put it in your mouth, and you could take this 2 seconds after you squeeze it, 5 seconds after, 10 seconds after. You don't have to worry about squeezing it and breathing in simultaneously. You could put the medication into the chamber and then take your time to be able to breathe it in. Now, one of the things is the flow in which you breathe in should be nice and smooth to get all the particles into your lungs. If you breathe in too quickly, this will whistle to tell you you're breathing in too quickly. So if you're breathing in at the proper flow, you won't hear the whistle. So here it is without the whistle. And then here it is with the whistle. So if you're breathing in that fast, that's an audible reminder to say, hey, slow down. Let's get those medication particles deep into the lungs. Smoother flow getting it down there. So this will really help you. You could talk to your doctor about this. I believe that you're going to need a prescription for it. So if you feel that you're having a hard time getting this coordinated with your breath and doing all these things, ask them for a spacer. It doesn't cost that much money, but it's well worth it to ensure that you're getting the medication deep into your lungs. Also remember, after you do your first puff of this inhaler, you want to wait 3 to 5 minutes to allow the particles to drop and keep opening up the areas of the lungs that they touch. So time is on your side. This buys you more time. Talk to your doctor about this. This is something that a lot of patients have found to be very, very beneficial. Okay? I hope you enjoyed this video. Thank you so much for taking the time to watch this. I really appreciate your support, and I want you to know we are here to try to help you. If you have any questions or concerns, you could leave questions or concerns below in the comments section. Also, you can go onto our website, pulmonaryrehab.com, or on facebook.com/pulmonary rehab. Thank you so much for your time. I wish you the very best in health. Any questions, let us know, okay? Thank you. Have a great day.